Okay, so today is our last lecture for impression materials exam that we'll have next week, right? We'll have it on Tuesday next week, correct? Yeah, on Tuesday, exactly. So that is our last lecture. So this exam will have impression materials, which is chapter 15. We have implants, chapter 12. We have chapter 13 that are abrasives, and part of chapter 16 that are dental waxes, and then chapter 18, which is the provisional restorations. We're not talking too much about provisional restorations because, well, we're just talking general broad lines and know the specific materials that we use. Just generally because next semester you're actually going to do that in lab, so it makes more sense when you actually do it with your hand and work with it. But for now, at least we can get to know some of the materials that we use and cements that we use for provisional coverage. So when we say provisional coverage, we mean what? What do we mean by provisional coverage in the first place? Huh? Temporary. Provisional coverage means temporary coverage. So temporary crowns, right, on bridges that we do for patients. And we talked about it a little bit before. So when a patient comes in for a crown, for example, right, we prepare the crown, we take impressions, but we cannot let the patient go without covering their teeth back, right? Because usually the crown delivery from the lab will take at least a week to 2, right? Because we have to send the impression to them. They have to put models. They have to create the crown and do it all the ways and all, to make it permanent. So within that time period before, once we prepare the tooth until the patient gets the actual permanent tooth, we have to give them some kind of coverage. And we'll talk about the reasons in a second here. But that's what temporary is. And also not just temporary coverage, but sometimes temporary filling. So instead of making a permanent filling for the patient, like a composite or amalgam, in some cases, when we need a little bit more time to work on the patient, or the patient cannot afford, for example, making a complete crown or bridge, we can just, for an intermediate time between our work or when they're ready, we can just put a temporary filling in there. Okay. And definitely when we put temporary crowns or bridges, we need temporary cements as well. So that's what we're generally going to talk about: the temporary crowns mainly, or bridges, the material that we use to actually make these bridges and crowns, and then the material to cement them, and then what materials that we have for temporary fillings. Okay. So it can be definitely used for all kinds of different things. It can be for general, it can be for pedodontists, for kids, especially stainless steel crowns. Endodontics sometimes, to cover the tooth before we do a root canal treatment. Prosthodontics, anyway from there. Okay. So what do you think generally the period of time for a temporary crown or a temporary coverage? How many weeks we might put it there?
1 month.
Okay. Yeah, it's about from maybe 2 weeks to a month. That is our expectation for a temporary material, from about 2 weeks to a month. Because usually these materials, again, from the name, they're temporary. They're not going to last that long. They're not that strong to withstand too much of occlusal loads and usage and mastication forces. Again, because they're just there to do a specific thing for a short period of time until we get the permanent restorations back. And a lot of times we take these out of occlusion, which means we drill them down a little bit more so that the patient doesn't really bite on them directly. So again, because they're just there to more protect the tooth and all of that. Sometimes we require a little bit more time. I mean, again, these are rare cases, but most of the time when we actually do a temporary or provisional coverage, what we do is about 2 weeks to a month. That is the coverage that we have. Okay. So why we do it, or what is the criteria for a good provisional coverage? What is the main reason that we do a temporary crown for a patient? So we know for now, at least aesthetics, right? The looks. So the patient doesn't go out and have an empty space on their teeth, right? But it's really more than that. It's much more than that when we do the temporary restoration. So this is like an example of a crown that we prepared. This is the original tooth. Let's take a look at that. So this is the tooth that we drilled out, right? And that's the temporary crown part here that we have. So one thing is, you can see in the picture, for example, the temporary crown is also helping the food to get through the right way, right? The regular physiological way of how food gets around, instead of getting stuck into the gum and the gingiva, right? Because if we left it open, it can go into the gingiva, it can go into the gum, right? What if we didn't put a temporary crown here, right? And then all of the stimuli, all of the hot and cold food, and all of the bacteria can go where? Can go directly on that, that exposed surface of the tooth that is not protected. So we can protect the tooth as well. So we're protecting the gum, we're protecting the tooth, and then we're restoring some of the function. And so these are the main things that we are actually trying. And also definitely remember that most of our teeth are actually pushing down to restore the space. So for example, if you have a tooth that is extracted, usually your other teeth that are next to it will start shifting to try to compensate for that space. So they will tilt in. So when we have a tooth that is drilled and ready for a crown, there's this empty space that other teeth can start jumping in and take. And we definitely don't want to have that. We want to restore the tooth exactly the way it is. So temporary crowns also keep the space for the tooth until we do the permanent one. Okay? So these are the different uses of it. So let's take a look at these planks that we have. So maintain the prepared tooth position, right? Relative to adjacent teeth. That's what we looked at the last picture here again, because it is, again, other teeth will usually drift to close up any empty spaces. And if we didn't put any temporary restoration, we'll lose that space. And by the time the permanent crown comes back, we cannot actually place it in there, because now things change, right? Protects the exposed to surfaces and margins. So as I said, these surfaces are exposed. They can get all the irritants. They can get all the bacteria if we didn't cover them. And we want to keep that prepared tooth surface nice and clean and protected. And definitely the margins, because these are the margins that the crown will sit on once we get it. And protect the blank tissues. These are the gingival tissues, exactly, right? That's what we said. So it will reflect the food the correct way. It can keep the gum from overgrowing, because also the gum can overgrow and can cover the margins of the tooth. And then provide function, some function, and aesthetics. Aesthetics means looks, right? And it can provide also retention, which is technically keeping all of the teeth in their place aligned, because again, all of these spaces are closed. So that's the importance of temporary coverage. Again, it's not just aesthetics, it's a lot much more for a successful permanent solution for the patient, or for our case, for a permanent crown or a bridge or whatever the case is, for healthy gums, right? All of that is part of why we do a temporary restoration. And it's important to, also kind of explain that to the patient, so that they know it's not just that's it. A lot of patients, or some of the patient, when they lose their temporary crown, they just don't do anything. They say, well, I'm just going to wait until the permanent comes in. But we always have to advise the patient, and you'll see in the end, and the last slide, that we have to tell the patient this is an important part. If it got lost or you break it or anything, you have to make an appointment and come in as soon as possible for us to restore it for you, to make another temporary crown for you. Okay. And again, being, stuck in place with temporary cements, these things can happen. So some things that we want to see in a temporary restoration. So it resists the forces of mastication, abrasion, and wear for a short period of time. We don't want it to irritate the tissues or have some bad taste into it, right? We want to match the color, again, because of the adjacent teeth, because we want the patient to go out with a nice aesthetics, right? And it's stain resistant a little bit, again, for a short period of time, and something that is easy to use, inexpensive, and repairable. So these are the things that we look at when we're trying to choose a good restorative or a good temporary material to make the crowns or bridges for our patients. Now let's talk about the main provisional. I mean, here it's not just crowns; it's crowns and bridges. In a way, you can say. Generally, what are the types that we make the temporary crowns or bridges from? Okay, but let's say crowns for the easy way to do that. So we have two types. We have ones that are prefabricated or preformed, right? So they're already done. The companies makes them. They give us like a complete set of crown sizes and shapes and colors, and then we try to match it to the patient teeth, right? To the color and the size of the patient teeth. Because if you have something that is pre-made, you have to have different sizes. Just like for impression trays, for example, we have the pre-made impression trays, which are the stock trays, and we can just have, like, for example, medium, large, and small, right? So same thing with the crowns. You just get, again, a complete set, and you can try and choose the ones that will fit the patient better, right? So if we have a preformed one, then that means the other one is just like with the trays, we have the custom made ones. So we make the other type of crowns or temporary crowns that also mostly done nowadays are the custom made crowns. And we did see a video where they made the crowns. Remember that video? And they took the polyvinyl silicone impression and they put the material on it and they make temporary crowns on the patient. We saw that. This is the custom made crown. So technically, we're making the exact replica of the patient teeth that we're drilling. It will look much more natural. It is much better adaptation. But again, we'll talk about each type of these types of crowns. So just to tell you here, well, yeah, I guess we have these other pictures anyway in there. Okay, so this next slide is about the preformed crowns, which are the ones that are pre-made by, different companies. So guys, can you recognize these? These are silver, which we call stainless steel crowns, right? These are the stainless steel crowns. So these are one of the most used ones in pediatric dentistry, right? They would cover the baby teeth. There are new types of them that actually have white coloring on them just to make them look a little bit more like natural, especially for anterior teeth. But these are stainless steel crowns. They're really good, adaptable, because they're thin. And, even though that they're thin, they still have can withstand a lot of occlusal loads. But the good thing about them is, again, because they're thin, we don't have to prepare the tooth too much. So like for baby teeth, we just kind of drill around it a little bit, shave it a little bit before we put that temporary crown on, the stainless steel crown on. Okay, so that's one. These are called polycarbonate crowns. These other ones. These are kind of plasticky crowns in a way. And again, these come in a sets that you that have different sizes and shapes and shades sometimes. They're hollow from the inside, so they're empty from the inside, and usually we fill them up and some, with definitely with temporary cements, and sometimes we can change some of the color by using a different type of cement, or sometimes even a composite inside of them, so that it matches a little bit better. These are called resin temporary crowns. So these are kind of more newer versions of the polycarbonate, but these are like composites. So it's like the filling material. They are light cured by themselves. We can kind of shape them a little bit. They come soft. So this one, the polycarbonate, comes hard. It's just like a plastic that is hard. You cannot really control much of it. You can trim it a little bit and try to adjust it as much as you can, but it's like a plastic that is a little bit hard, while the resin ones are more soft. And then we cure them to make them hard. Okay, so that's the main difference between them. And again, it's all about the cost for each one of these and the dentist preference. These are called celluloid crowns, from what they look like. They're just shells. Sometimes they call them crown shells. And these are just plastic, clear plastic that looks like the tooth shape, right? But guess how we use these? You think we place like this empty plastic inside a patient mouth and just leave it that way? What do? How do we use these? Fill them up, right? So we fill them with composite, the filling material. We fill these up, put them on the patient mouth, and the reason they are clear is that so we can cure with curing light through them. And once we cure them, we can take them out. And again, I have videos for almost each one of these types, so you can see how it's done. But you cure through them, and then you have a crown made from that, celluloid formed crown. Makes sense? Anyway, there are different types. And then we have the aluminum shells and tin silver, which is, I don't think you'll see these at all. All of the other types most probably you'll see, definitely stainless steel crowns, polycarbonate, resin, celluloid crowns, yes. On the exam, I might give you a picture of one of these and ask you, what is that? Okay. So you can see these are the stainless steel crowns. They come in a set with different sizes. I went to the other slide by mistake, but this is the polycarbonate crown. And again, you can see how they come in a set with different sizes and different shapes for different teeth. So you can try to match them. And this is, again, these are stainless steel crowns. Okay, so we're done with the preformed, the ones that are already made for us. And these are the different types of materials that they use from the preformed ones. Now let's talk about the ones that we made, the custom-made crowns. So as I said, because they're custom-made, that means will be better in the function, better in the fit, and better in the aesthetics. So the main thing is that we're taking an impression for the patient teeth before we prepare them, and then use it to make that temporary crown. So our temporary crowns will look exactly like the way that the actual teeth looked like in the first place. Okay. So another thing that custom-made crowns can provide us is that we can make multi-unit bridges. So, with the other the other crowns that we actually looked at, they're only one unit. So you can only cover one tooth, right? What if your patient needs a bridge, 3-unit bridge? So how are we going to leave the patient without any teeth, or we have to glue these teeth together? So with custom-made crowns, again, I'll show you a video about this. You can actually make a complete bridge that is temporary, while with the other ones you cannot. Okay. We have two main materials that are used nowadays. We have the acrylic, which is this one. You'll see it in some offices. It's really cheap. It's kind of more of the older way of doing things. It has a liquid and a powder, which you have to mix to make a crown. And nowadays we have these type of materials that are resin. These are the resin, which is technically like composite. And again, it has a specific gun. Looks like the dispensing gun that we use with the polyvinyl siloxane, but it's actually a different type in a way. Anyway, it has also a cartridge and a mixing tip that will do the mixing for you. And nowadays, again, it's more used. This is the kind of the most used way to do temporary crowns. So one thing with acrylic, or one problem with acrylic, although it's inexpensive, which is a good thing, but it actually shrink and it can release heat when it is setting. So the problem with it, once you make it, you have to keep putting in and out, outside the patient mouth, in and out patient mouth, because it's heating up. And when it heats up, when it sets, it can actually hurt the tooth, especially if the tooth is still vital, alive. So we have to take it in and out, and in and out, and in and out until actually it cools down and stops shrinking. And again, if you took it out too much, it will shrink that you cannot even put it back into the patient tooth. So these are the issues with the acrylic. But again, it's inexpensive, so some dentists might still use it. Well, with the composite resin, it is a little bit more expensive, and it has definitely better aesthetics. So it's easier to use and easier to work with. Do you have any questions? Do we fill all of these out? Yes? And this is technically how, this is the resin that you're seeing here. This is the composite resin. We have an impression of the patient teeth, right? And then we're just filling them out with the composite resin, and then we're going to put it onto the patient tooth. So let's go ahead and see a video here. Again, all of these videos are on your Canvas, so if you want to look at them, they're there. For example, let's see this. This is the last thing that we talked about, which was the, what was that? The temporary crown. So you can see this patient needs a bridge here, right? They're all of their teeth from, looks like the premolar, first premolar, second premolar, and molar, first molar are all gone, right? Or, well, not gone. They're prepared for a crown, a bridge, or crowns, technically. You know, each one of them will have a crown of its own. But anyway, it's 3, and all of these needs to be covered, right? This is rubber dam that you guys are going to do. What is this material? Putty, right? That's the putty polyvinyl siloxane. Guys from the last, from the first lab, which are Wednesday people, started mixing putty. So we're getting there for Friday and Monday people. Going to mix putty PVS. So it looks like that, and you take just equal amounts of the material, and then you're going to make, you can make an impression. You mix it. You see they mix it with their hand because it's better not to mix it with latex gloves. What they did here, they call this an indirect way. So they already took an impression of the patient for the model, and they're going to take an impression on the model. This is called an indirect way of doing it. Usually we do it directly on the patient before we prepare the tooth. Okay? Anyway, so these teeth are not prepared yet, or an example of the teeth that are not prepared yet. And then we're making an impression of them, right? See our impression now have all of these 3 teeth that we want. I guess they're trying to take even better impression with a light body. This is the technique he's using, and usually we just do it directly on the patient mouth. But this gives you even better fit. You can cut that, you know, make it smaller, because technically the only part that we need are the crowns. What is this material that they're using? The composite resin, right? The composite resin that is used to make temporary crowns. As we said, because with the temporary crowns, we can have acrylic material, right, that you mix powder and liquid with, and then you have the composite that comes in a gun, or composite resin that comes in a gun, and you can put it on the teeth directly. So now they're filling that impression that they already taken from the patient that has all of the unprepared teeth. And now these are the teeth that we're trying to restore, right? And they're actually going to, again, that's their technique. They're going to put it on the teeth as well directly. Usually we don't do that, but this might probably give you better fits. Make sure you don't have any bubbles. So this is, again, this is not an impression material that we're squeezing out. This is actually temporary crown material. We'll put it back on side patient mouth. Wait for it to sit a little bit. Now we're taking it out. Now we have these like a bridge, a temporary bridge for all of these teeth. You'll see they are take it out. What are you saying? Now I guess they're going to take the actual final impression. This is the final impression, light body, heavy body. This is bite registration. And now they're actually doing the temporary crown. See, they put a little bit of coloring so that they know where to drill. Usually that's what we do as dental assistants. This is our part. We can clean up and make our temporary crowns really nice. You can see they're using different burrs and different hand pieces to make sure it looks nice and fits well and doesn't have any hard parts into it. This is all outside patient mouth. I guess they replaced it now, right? And they put a temporary cement to it, which is technically, I guess, a composite. They're curing it with a curing light. What is that thing here that they're using? Articulating paper, right? Articulating paper with articulating paper forceps. This is part of your instruments that Ms. Jukes showed you, right? You'll see it will register any high points. And now they're drilling all the high points that are extra. Again, we usually take it out of occlusion. Super seal. I guess this is a desensitizer. What is that? Cleaner, desensitizer, that other thing. They're going to polish it, most probably here. Let's move on. Yeah, they're polishing it again to make it look nicer. Put the temporary cement material into it. And all looks good. Asking the patient if they feel okay with it. Removing any excess temporary cements. That's the high volume evacuation. Removing it from the lingual sides of the teeth. There you have it. They're floss a little bit to make sure it's nice, and that's it. Looks nice, huh? That is the custom-made crowns. And again, this is the most recent ways of doing that, using the temporary the composite resin material. Okay, and this is really nice. And again, you will do a lot of this in offices. And again, we're going to do that next semester in chairside. This is, what do I want to show you? Biotems, strip crowns maybe. So these are what are these? These are the celluloid crowns. Remember the clear ones that have just a clear shell? And this is how they're using it with kids, at least for this doctor. This is how you're using it. Again, he's doing it indirectly, so there's already taken an impression of the patient teeth, and they're chosen the correct size of the celluloid crown, because they come also in different sizes and shapes. So they chose that one, and you'll see they're going to try it onto the teeth again, that on the impression, technically on the cast, and then just making sure that it fits really well and nice. And now they're going to fill it up with, well, they're drilling it a little bit more. Oh, they're doing a vent hole so that it can get the extra material out. Did they put composite? They haven't yet, I think. Now they're putting composite. This is composite material, which is technically a tooth filling material. They're going to fill it up. The celluloid crowns. Make it look nice. Put it back onto the patient teeth and then cure it. And by that, you're getting your temporary crown, technically. They can even use them to do some kind of permanent restoration as well. If you have some edges that you want to get, sometimes the dentist would use these celluloid crowns to get these edges correct and nice, and the anatomical landmarks all with it. He's putting bonding or some kind of, it's probably put some separator. I think bonding a little bit. I don't know, I have to see the video, but looks, that's what it looks like. And then see they're placing it on the tooth. All the extra stuff will come out, and then you would reduce all of that or remove it. And then you have to cure it so it sets. And once you cure it, you can cut off. So you see they're using a blade to cut off the celluloid shape of the crown. And what remains is just a complete nice crown out of composite. So they're removing the celluloid, as you can see there. Awesome. Trash that. And now you have a nice crown for your patient. No, usually direct action. Yeah. And again, as I said, they can even be used for an actual complete, for actual filling. So, for example, you do kind of what they call it a direct veneers. So you drill out the tooth and you can make a nice shape of the front teeth, even for adult patients with that, because it really restores. You don't have to do the anatomy with your hand. It's all made for you. It's just directly onto the patient teeth. This is just for stainless steel crowns, and again, same thing. They measure them first to make sure that they fit well. And you can see the tooth is barely prepared because, again, stainless steel crowns are really tiny or thin, so you don't need to prepare too much of the stainless steel crown. Drying it up. Nope. I have to. Well, so have my mic on. But anyway, you saw, well, they put some temporary, they put permanent cement on there. They asked the patient to buy it. They're removing all the excess cement. And then you're done. You have your permanent, you have your stainless steel crown there. Cleaning up, removing all the extra cements from all the edges and the sides. Yeah, he's really nice patient. You're going to have a lot of kids that will be that cooperative with you. We're just doing some, I guess, polishing a little bit to clean up the teeth. And then again, they're doing that on the other side as well. I think they put a separator there. I'm not sure. Just to push the teeth a little bit apart so you can put that temporary, stainless steel. So stainless steel crown can fit in there. There you go. Definitely these can be cut a little bit more, adjusted to the sides. Flossing in between them. And there you have it, a happy patient. Hey, I think she said like you have Superman teeth or something like that. Yeah. Okay, that's a happy patient. So I think I have other videos here for you guys you can watch. This is a polycarbonate crown being made. These are the ones that are, see, this is the polycarbonate crown, and then you mix something into it and you put it in there. You can even use composite. You put it on the teeth, and then you take it out, in and out, takes just to make sure it sets, and then you drill it a little bit more. You put that's a temporary cement here. They're going to mix. See, that's the one that they chose. Mix the cement, put it inside of the crown, put onto Dexter, hold it in place, clean it up, you're good to go. That's the polycarbonate crown. Anyway, again, a lot of nice videos there for you guys to see if you want to. So let's go back to finish this. It's not coming up. Okay. Moving on, a few things to cover. The temporary cements. Now, again, just differentiate, guys. We have temporary material that we make crowns with, like stainless steel, polycarbonate, resin, celluloid, right? But we need a temporary cement to cement them in place. So technically, we have three of these. I didn't want to go too further in these because we're going to do a lot of cements later on. We actually have after impressions. We're going to start mixing cements. So we're going to talk more about cements later on, more closer. But it's good to know the main cements that we use. So we have zinc oxide, eugenol, and you'll be hearing a lot of that. Remember, we had an impression that also zinc oxide eugenol, right? ZOE, it's part of the inelastic impression material. So you can have a eugenol and non-eugenol ones. The good thing about this type of cement is that it actually has a sedative effect. When we say sedative, means what? Numbing, right? Numbing effect. So sometimes, for example, the patient have some pain, still have some pain or sensitivity, and then if you're using this cement in there to cement the temporary crown, that sedative effect in it, it will reduce the pain of the patient while they're waiting for the permanent one to come in, right? And the eugenol is actually the one that has that sedative effect. And it comes from the cloves. These small cloves, right? That's where it comes from. And that's why sometimes, I guess a little bit in older times, people would chew a clove to reduce a tooth pain because it has eugenol in it, okay? One thing that I mentioned here that we'll mention later on, and cements. I mean, I reduced this lecture actually a little bit more than I used to. But zinc oxide eugenol, it interferes with the setting of resins, of composite resins. So if we're going to make a composite filling later on, it's better not to use the zinc oxide eugenol. Just keep that in your mind somewhere, because we're going to talk about that later in cements. Okay. We have also polycarboxylate cement that is stronger than ZOE, which is zinc oxide eugenol. And then we have resin cements that are the strongest and the most aesthetic. So technically, polycarboxylate, we actually have a material, a crown that is polycarboxylate, right? And a cement that is polycarboxylate. Resin, we have a crown that is resin, and we have a cement that is resin, right? When we say resin, now every time we say resin, just think about composite. Technically, composite is a type of resin. So resins are the things that we can cure with a curing light, these type of things. And actually, these are the this is zinc oxide eugenol. You don't have to really recognize these because we're going to mix this. This polycarboxylate, and this is the resin. And you see the resin is the nice one that you don't have to mix with your hand, right? It comes in a syringe with a mixing tip on top, and you just put it on there and cure it, and you're good to go, right? So again, we're getting there. All dentistry is going to less mixing and more pre-mix and more, syringes that have a mixing tip into it and less mixing by hand, but we still have some cements that we mix in hand. Anyway, a small slide about the temporary cements. Just again, know the three types. Which one is more, the sedative? Which one is the strongest? So these are, again, just the looks of them. So you see this one has a non-eugenol. This is one of the most used ones in offices, the temporary cements. They come in a small package. You cut from here and you mix with your hand. This is the one that has eugenol in it, if I'm not wrong. And then this is another type of resin cement. I'm not going to ask you to recognize these specifically, but again, just to show you. Now, we're talking about restoration, temporary or provisional restoration, right? Again, just differentiate. We have temporary material that we use to make the actual crowns. We have temporary cements to cement the crowns, right? And we have temporary restorations that actually, they call them intracoronal, so inside of the crown. Instead of making a composite or amalgam, we make a temporary filling sometimes. And again, we still have that zinc oxide eugenol, right? And we know that it has a what effect? Sedative effect, exactly. So see, zinc oxide eugenol is just everywhere. You can do it as an impression. You can do it as a temporary crown, and you can, temporary cement, I'm sorry, and you can use it as technically a permanent cement. This is actually called IRM, which stands for Intermediate Restorative Material. And we have it here. See, that's why IRM, this is the zinc oxide eugenol that is used for, and we call it intermediate because it's not temporary, and it's not permanent. It's just something in between, okay? And you can see, again, we have polycarboxylate that can be used also as a temporary filling material. And then we have this product that you will see a lot of. So the most products that you will see most probably in offices to do a temporary filling would be Cavit G. That's the product I want you to recognize. Cavit G, it's a pre-mix pasty-like material. You just take it and put it inside the patient mouth. A lot of times we use this in fillings, in temporary fillings. So like when we're doing an endodontic treatment, usually endo takes more than one session. So we drill the tooth, we take off the root, the nerve, and then we put Cavit G, for example, and then ask the patient to go, come back, remove that temporary filling, and then work again, okay? So see, there's another type of Cavit G. Anyway, again, recognize these temporary restorations. And we have new techniques to do that. So CAD/CAM nowadays, again, having the 3D scanners, we can just scan the patient teeth and send it to what do you call these? 3D printers, right? And the 3D printer will make a crown for you, and it will fit exactly the way it should fit and do it exactly the way it should. Again, dentistry is going that way, but we still need more years. But yeah, take a scan of the patient teeth, put it on the computer, print it out for you, and it'll be really nice and ready to go. There are other ones that we call them biotemps. These are actually made in the lab. So they are stronger, they're better quality, they have really nice aesthetics to them, better than the ones that we do in office chairside, but definitely they're more expensive. So, right, we saw all of these things that we talked about. These are done by us, right? Chairside, assistant most of the time, doing all of that work. In some bigger cases, for example, you're replacing all the anterior teeth and you're trying to do like all crowns or something like that. So these cases, you want really good temporary crowns that will fit much better and that will look really natural. So we actually send it to the lab. The lab would fabricate that to us, and then we drill the teeth, and then we put the biotints in. And I can answer that. We talked about that in impression. What CAD is CAM? CAD CAM. What does it stand for? Look back into the impressions slides. Computer aided design and computer aided manufacturing. CAD, right? CAD CAM. So again, temporary biotemps, they're really nice, and again, they're done in the lab. That's the difference between that and the other ones that we use. And again, at the end here, patient education, as I said, it is really important to educate the patient about our work that we're doing and why we're doing that, why temporary cements are important, temporary crowns, and how to take good care of them, right? Again, like a lot of times we ask them not to chew hard things or sticky things on our temporary crowns. If they got loose or lost, they have to come back to us to make another one, and to tell them this is a temporary, this is not a permanent, because some patients will think it's a permanent and they're not even come for their permanent, visit, especially if you've done a really nice work and make it really look nice. It can, some patients would not understand that. So definitely patient education is an important part of our job. And that's all, folks. So any questions? Go ahead. If the patient have a permanent crown, and then it's different colors like this, what can the dentist do? Most of the time, well, depending on the case, I don't think. Let me see this picture. I think this is actually, well, for this specific picture, I think this is actually patient teeth, but it's a dead tooth. Sometimes when the tooth is dead, it will change in color. But for example, if anything happened like that, we'll try, for example, to try to polish it back and try to make it look nice, because most probably it got some stains into it. So we can try that, and then if it didn't work, we have just to replace it. Crown, yeah. Yeah, just you take it out. We have a crown removal instrument. You take it out and then you put a new one. Yeah. And again, it depends. For example, if it was maybe a veneer, sometimes the cements that we put under the crown, because the crown is a little bit translucent, we can change the color of that cement. But usually that's when we do it in the first place. So, we try to match with the material that we put to cement the crowns in, or especially the veneers, because the veneers are really tiny and shells that we can see through in a way. We put the cements in a specific color to match the teeth, and then if it this color to that way, most probably it's just polishing or replacing them. Yeah. So let me stop recording here.